In this discussion, we'll be reviewing overuse injuries in young athletes. 60 million American kids participate in youth sports. Over the years, we've seen an increase in single sport specialization, and also in intensity and volume of sports training at younger and younger ages. These trends are part of the reason we're seeing more acute and chronic overuse injuries in youth athletes. Quite simply, overuse injuries occur because of excessive repetitive stress without adequate recovery. On top of that, growing bones may be less tolerant to stress. And kids have more weak links in the chain. For example, growth plates and other areas are particularly vulnerable to injury. As I mentioned earlier, early single sport specialization can lead to overuse injuries, especially if it's year-round, involves repetitive biomechanics, and there isn't enough recovery time. They can also be caused by sudden increases in training load. There are a number of other factors that can put children at risk for overuse injuries. These include inadequate nutrition, anatomic factors, poor technique or biomechanics in their sport, not enough sleep, prior injury, especially if they haven't made a full recovery before returning to sports, and psychosocial factors like stress from school, home, or social life. Some examples of overuse injuries are shown here, and I'll touch on them later. So what's the big deal? Kids should probably learn how to play through the pain, right? Well, probably not, especially young kids. These injuries can absolutely affect their quality of life. After all, nobody likes being in pain. They can mean time out of sport, and even though most of these heal up within a few weeks, some can be season-ending. So really, playing through it can just mean missing more time later. They can be very challenging to treat when they've been around for a really long time, and then kids struggle with pain even at rest. And they can certainly lead to burnout and completely quitting sports altogether. Some of these overuse injuries can put children at risk for worse problems in the future. These include fractures, ligament tears like the ones that need Tommy John surgery, and arthritis, for example, when chronic cartilage problems are untreated. In rare instances, they can sometimes even require surgery. How do you know if an athlete might have an overuse injury? Recurrent or chronic pain is usually the most common symptom. But some injuries, like the little leaguer's shoulder in this x-ray, may present with more functional problems than pain. For example, decreased pitch accuracy or velocity. Most of these start out pretty mild, so kids, parents, and coaches may not even pay them any mind. But they can progress to become very problematic, even causing pain at rest. At that point, they can be very difficult to treat. There are a number of factors that put kids at risk for overuse injuries. They're seen more commonly in endurance athletes like long-distance runners and others. Girls are thought to be at higher risk than boys for a number of reasons. Single sport athletes, as we mentioned before, especially when they play year-round, but this may also vary depending on the sport they play, their position, and the actual training volume. Recurring events like weekend tournaments and showcases absolutely add additional wear and tear. And importantly, kids who get less than a day of rest per week or 2 to 3 months off per year are at high risk. From a 30,000-foot view, the treatment of these injuries is fairly straightforward. Rest from the aggravating activity is absolutely crucial. Rehabilitation is another key component, whether it's done at home, with a physical therapist, or with an athletic trainer. The goal is not only to help the athlete feel better now, but to correct any underlying biomechanical issues that may have resulted in the injury in the first place. This includes stiffness, weakness, and technique, among others. Finally, before returning to sports, it's important to ensure that the athlete's schedule includes sufficient recovery time every week, every season, and every year. I'd like to quickly touch on some examples of overuse injuries so you can get a better flavor of what we're talking about. One category is apophysitis. The apophysis is where tendons attach to bones. In growing children, these aren't fused to the bone yet, making them vulnerable to injury. Examples include Osgood-Schlatter syndrome and Sever's disease, which are very common, as well as medial epicondyle apophysitis in throwing athletes. Bone stress injuries usually start out mild, maybe as shin splints that start taking longer and longer to get better, and the most common locations for these injuries are shown here. By the time a stress fracture shows up on an X-ray, it's usually somewhat advanced. These can lead to full acute fracture if untreated. Breaking a hip or a leg can be catastrophic for a young athlete. Tendinopathies are very common. Tendons are the structures that connect muscle to bone. Chronic overloading of these tendons can lead to microtearing and degeneration. A common example of this is patellar tendinitis in the front of the knee. Growth plate injuries are unique to the young athlete. Growth plates are how the body's long bones continue to grow. As with apophyses, these are unfused in young kids and are vulnerable to injury. When severe and untreated, these can lead to growth arrest and deformity. Examples include gymnast's wrist and little leaguer's shoulder, as shown in these X-rays. Finally, some overuse injuries can be very limiting but have normal X-rays or MRI. A common example is patellofemoral pain syndrome, which involves the front of the knee. These kinds of issues can be incredibly hard to treat when they become very chronic. So how can we keep our kids healthy and avoid these issues? If there's one thing to take home from this discussion, it's right here. An athlete should not train more hours per week than their age. For example, a 10-year-old should not train more than 10 hours per week. Athletes should rest fully from organized sports at least 1 day per week and 2 to 3 months per year. It's important to work on technique, mechanics, strength, and mobility, to get adequate nutrition and sleep, and to deal with other sources of stress. If we can ensure these things, then we can keep our kids happy, healthy, and in the game. Thank you.